It's one of breast cancer surgery's biggest advances in recent years, breast-conserving surgery, or what's usually called lumpectomy.
But it also means a fairly long series of radiation treatments to keep the cancer from coming back. Dr. Max Gomez is here now to show us a much easier and convenient way to administer those radiation treatments. Doctor?
That's right. Good morning, Rob. Good morning, Mary. You know, the reason radiation is important after a lumpectomy is to reduce the chance that a woman will suffer what's called a local recurrence, meaning that the cancer will come back in the same spot as the original tumor. Now, that usually means 6 or more weeks of daily radiation treatments. Here's an easier way.
This is what a routine mammogram looks like. Pretty normal until you look really closely at these tiny white specks.
We call it microcalcification. This is the early sign of the cancer. We call it ductal cancer in situ.
It's disheartening. It's always bad news of course, you don't know how bad it is and what they're going to have to do.
Fortunately, Dorothy had been having regular mammograms, so her cancer was at an early enough stage that she was able to have a lumpectomy just a few months ago. But then she was facing weeks of radiation therapy to prevent a recurrence of her breast cancer.
I think it's a major inconvenience for the patient. I think, especially for the elderly patient, has difficult time with transportation. It's very difficult.
But there may be an easier way. This device, called the IntraBeam, delivers a dose of radiation right into the tumor bed, meaning the area where the cancer was just removed. The advantage is that it happens during the same procedure as the lumpectomy. So when the patient awakens, her treatment is complete. A recent study found that this approach was just as good as weeks of conventional radiation.
There was an equivalent local control rate. In other words, the amount of patients who recurred was the same relatively in each group. So it was a positive trial for using just this intraoperative radiation for the select group of patients with lower risk cancers.
Aside from the obvious convenience, the IntraBeam tends to cause fewer side effects.
I feel nothing. No problems. The recovery time was no time.
Now, the key here is that the patients who were part of the study were all considered low risk, meaning most were older and had very early stage and not very aggressive breast cancers. It's not clear whether the IntraBeam would be as effective for women who had more advanced cancers.
And for those early stage women, is it one treatment and then done?
Well, for some, that's the way it would work. For other women, the IntraBeam is considered a radiation boost, meaning if you have a more aggressive looking tumor under the microscope, when the pathology report comes back, you may still need conventional radiation, but a shorter course thanks to that initial radiation boost that you got in the IntraBeam. And it's done right during the surgery, so it's sort of not a whole lot of extra trouble or effort or risk or anything.
Still, what a great advancement.
Yeah.
Doctor, good to see you.
Thanks a lot. All right, it is 5:49 now on this Tuesday morning. We're going to update our forecast.